So the agreement this morning was to train champions, to build capacity in the field of palliative care for our hospitals in Kenya and Tanzania. We have 4 hospitals in Kenya and Tanzania, and a baseline survey that we did in 2014 demonstrated that palliative care was a large unmet need in these regions. And therefore, in discussions with AFD and then with other French partners such as Expertise France and Institut Curie, the program for building capacity in the field of palliative care was developed.
The relationship between AFD and the Agha Khan Development Network is a long-standing one, and it is in a number of sectors. We have a long-standing relationship with the Agha Khan Development Network, and growing, especially over the last few years, on the social sector. And if I take the example for health, we have intensive collaboration, and like I said, growing if it comes to the health sector, including hospitals, let's say, in Afghanistan. In fact, early next week we hope to open the new Bamiyan hospital, where the AFD works closely together with the Canadian government, as well as obviously the Agha Khan Development Network. But there are also other collaborations in Afghanistan, in Tajikistan, in Pakistan, in East Africa countries like Tanzania and Kenya. And the relationship is strong, if I specifically talk for the health sector, because our vision and our thinking is very much aligned. We still have the infectious communicable diseases, but we also have the growing problem of the non-communicable diseases. And there are not so many agencies and entities who have already started about that new burden of disease in low-income countries. And I think one of the things which I would like to praise AFD about is that it really thinks that way, that it is thinking about the future. It's thinking not only about what you could call vertical programs, but the whole health systems approach, and looking and seeing that in the context of the burden of disease of the populations which we are working with.